Alright, I'm going to be doing a assessment of my patient here, Dustin. We're doing this standing just for video purposes, but in the clinical you would have them either laying down or sitting up, and you could reposition them as you needed to. So first I'm going to gather my supplies, wash my hands, and explain what I'm going to be doing to my patient. First of all, I'm just going to observe his overall appearance and look for any deformities, check for mobility, gait, and range of motion. So I'm going to have him just go ahead and bring your arms all the way around so I can check and see if you have any limitations in your other arm. Okay. Can you bring your legs up 1 out of 10? Good. Alright, I can see that he doesn't have limitations in the range of motion. Checking for hygiene, he doesn't smell, his clothes are clean, there's not like dirt under his nails, anything like that. I'm going to be assessing his skin throughout the whole assessment, looking for color, checking the nails for capillary refill less than 3 seconds, and the toes as well. You can also look at the lips to make sure that they're not blue and that the skin is nice and pink and not pale. I'm going to look at his posture. He's standing up straight. He's not bent over due to pain or aging. If I ask him questions, he has appropriate speech and he responds appropriately back to me, so I know that he has adequate hearing. I can tell that he has good nutrition, he's not obese, and he's not underweight. His eye contact is good. When I look at him, he looks back at me. He is alert and oriented, and I can ask him specific questions, who's the president of the year, how old are you, things of that nature, to assess that. And then I'm going to look at his scalp and his hair, and I'm actually going to palpate to see if there's any thing that's asymmetrical or bumps or lesions of that sort. So you just go ahead and feel down the skull, and it all feels symmetrical. And then we're going to look at the face. You look from one side to the other, it's symmetrical. There's no drooping. The temporal arteries, you can feel both of those, and they are present. And you look at his TMJ, and you have him open and close his mouth for me, and you can feel that. There's no clicking, it's not asymmetrical. And you can look at the maxillary and frontal sinuses to see if those are tender. Are those tender at all? Okay. And then we're going to look at the eyes for confrontation, cornea, light, and positioning. So we'll start out, I'll look at each eye, the pupils, and see if they constrict and dilate appropriately. So I would take a pin light and I would shine it in one eye, looking at that eye to make sure that it constricts appropriately, and then looking at the opposite, and then I would do that on both sides, and they respond appropriately. And then I'm going to check the dilation when he looks at something far away and close. So pick something on the wall, and then look at my pin light, and then at the wall, and at my pin light, and they constrict and dilate appropriately. For the cover test, I can cover one of his eyes, and there's you look for like a lazy eye like that, and they don't twitch, so they look good. And you inspect all of the parts of the eye, looking at the conjunctiva, the sclera, the cornea, the iris, the pupils, and if you look right at me, I can look at all of those things and tell that they look healthy. Next, I would assess his vision with a Snellen chart. I don't have one of those, but I could assess for how acute his vision is by placing one of those on the wall and measuring the distance and having him read off whichever line he could read for me. Next, I'm going to look at the ears. I'm going to first just inspect the outside of the ears. For the external structures, they're symmetrical on either side. I don't see any bumps or lesions, any sign of infection, redness, heat. If I had an otoscope, I could actually look inside at the internal structures, the canal, and the... Okay. Next, I'm going to look at the nose. I'm going to inspect outside, looking for symmetric... see if it's symmetrical, looking for lesions. I'm going to assess the patency, occluding one nostril, having him breathe, and then occluding the other side, and I can assess that both sides are patent. And then I can look inside of his nose, looking at the mucosa, the septum, and the turbinates. Just go ahead and put your chin back. And you shine your light in there and you can see those things. Next, we're going to look at the mouth and throat. Inspecting those, looking at the mucosa, the teeth, the gums, the palate, and the floor of the mouth. Go ahead and open your mouth for me. I can see all those things. And then I'm going to look at the uvula and the tonsils to grade the tonsils, and I'm going to have you say "ah" for me. And there's no, you didn't say it. And there's no swelling in the tonsils, so I'm just going to grade those as a 0. And then I'm going to have him stick his tongue out for me. Good. Checking for cranial nerves. Next, I'm going to look at the neck. I'm inspecting it first for symmetry, masses, then I'm looking at pulsations of the neck, for jugular venous distension, and then I'm going to palpate the carotid artery on either side. Good. Next, I'm going to look at the trachea and the thyroid and actually palpate those. I can feel the trachea. You're feeling for deviation from one side or the other, and then the thyroid. It's right there. And to see if they have an enlarged thyroid. And then I'm going to look at range of motion and muscle strength with the neck. Go ahead and move your neck down and side. Either side. And back. Good. All appropriate. And no decreased range of motion. Next, I'm going to look at the chest. And normally you would have them remove their shirt for this. I'm going to look at the thoracic cage for how symmetrical it is, to palpate it, and for expansion. So I'm looking for tenderness or masses with this. And then with expansion, you're going to place your hands around the chest and then have them take a deep breath in and out and in. Okay, go ahead and turn around. I'm going to do the same thing on the back, all the way around. Okay, deep breath in and out, in and out. They're symmetrical on either side, which is what you want. Okay, and then you would percuss their chest, tapping. Obviously, with a shirt on, it's not going to be accurate. And then you're going to auscultate all of the lung sounds. So each time I move my stethoscope, I'll have you take a deep breath in for me. Okay, go ahead and turn around. And I'm going to do the same thing on the back. Okay. And then I'm going to listen to the heart sounds, listening for the 4 valves with both the bell and diaphragm. So I'm going to start with 2, intercostal space 2 on the right, and 2 on the left, and 4, and 5. And for the 5, you shift over to the midclavicular line. And here I'm going to listen for a full minute, listening to rate and rhythm. And then I'm going to do the same thing in each place with my bell.